The human body is divided into different regions with its own specific therapies that can promote wellness, especially in spa settings. So, these are the body regions. First is the head and neck. This region includes the skull, jaw, and neck muscles. Therapies such as craniosacral therapy and facial massage focus on alleviating tension in this area. So, kinesia head and neck. This area is often targeted for tension, headaches, stress, and even sleep problems. So, when we say craniosacral therapy, it is a gentle hands-on technique used on your skull and spine to promote pain relief by decreasing tension. So, second is the torso. Torso encompasses the chest, abdomen, and back. Techniques such as deep tissue massage and body scrubs often target muscle groups in the back and core to improve overall well-being. So torso, the chest, abdomen, and back, these are the key areas for addressing back pain, improving posture, and promoting better digestion. So the third is the upper extremities. Upper extremities comprising the arms and hands. This area benefits from massage therapies that alleviate tension and improve range of motion. Back, especially for individuals engaged in repetitive tasks. So like for example, naikat ng mga individuals who works at computers or kanang mga musician. So the last is the lower extremities. So lower extremities includes the legs and feet. Reflexology treatments commonly utilize the knowledge of this region to enhance circulation and reduce fatigue.
Endangerment sites of the face and neck. Anterior triangle of the neck. The anterior triangle of the neck consists of medial border of the sternocleidomastoid muscle, the inferior border of the mandible and the trachea. The anterior triangle is home to various muscles susceptible to trigger points, which can cause pain and stiffness. So massage therapists target these areas to alleviate tension. The anterior triangle also contains lymph nodes that can become congested. Massage therapies uses gentle massage techniques that can aid lymphatic drainage, promoting relaxation and reducing swelling. Posterior triangle of the neck. This area contains the brachiocephalic artery and vein superior to clavicle, the subcephalic vein, and the nerves of the brachial plexus. The posterior triangle is prone to muscle tension due to stress and poor posture. Massage therapy targets this area to relax muscles, improve range of motion, and reduce pain. One techniques that massage therapists uses are like effleurage and petrissage, which can enhance blood flow, helping to reduce inflammation and promote healing. Mandible. The area posterior to the mandible contains the facial artery and nerve and the styloid process of the temporal bone. Massaging this area can ease tension in the facial muscles, reducing temporomandibular joint or TMJ pain and promoting relaxation. The therapist must be cautious when massaging near the styloid process to avoid discomfort or injury. By understanding the anatomy and relevance of these areas, spa therapists can provide more effective and safe treatments. Endangerment sites of the abdomen. Now, let's discuss the umbilicus area. The umbilicus area to either side contains the descending aorta and the abdominal aorta. This spot, near the belly button, contains the vital blood vessels. The descending and abdominal aorta supplying the blood, abdominal organs, and lower body. Massage therapists need to avoid deep pressure and use gentle strokes here to prevent discomfort or injury. Now, what about the dorsal body area near the 12th rib? Dorsal body area, 12th rib. The dorsal area in the region of the 12th rib is located over the kidneys in the lower back. This spot overlaps the sensitive kidneys, which filter waste and toxins. Massage therapists should also gentle massage techniques to relieve tension without irritating the kidneys.
Here is an explanation of its anatomical region. Axillary triangle underarm region. This is a triangular area under the arm bordered by structures of the shoulder and chest. It serves as an important region for blood vessels, nerves, and lymph nodes. Deltoid pectoral triangle. A narrow anatomical region bordered by the medial aspect of the pectoralis major, the lateral anterior deltoid, and the superior clavicle. It contains the cephalic vein, which is commonly accessed in medical procedures. Sternal nodes and anterior throat. This area includes the sternal notch, a depression at the top of the sternum, and the anterior throat form the medial ends of the clavicles where they attach to the superior edge of the sternum. It is a key landmark in anatomy and clinical practice. Here is an explanation of the endangerment sites of the lower extremity. Deep cuff. This area is located between the two heads of the gastrocnemius muscles in the lower leg. It is a sensitive region as it contains structures like the tibial nerves, posterior tibial artery, and veins. 2. Tarsal tunnel. Found on the medial side of the ankle, this site is a groove near the calcaneus heel bone located inferior and posterior to the medial malleolus. It houses important structures
Organization
like
of the
the
human
tibial
body
nerves,
major organ
tendons,
system.
and arteries,
Respiratory system
making it a
facilitates
crucial area
gas
for
exchange.
movement and
Techniques
sensation
such
on the
as
foot.
breathing exercise can be integrated into wellness practices to enhance the relaxation and lungs function. So when we say respiratory system is responsible for intake uh, of oxygen and the removal of carbon dioxide from the body. Digestive system engage in nutrient absorption and waste elimination therapies that focus on the abdominal region can support digestive health. So when we say digestive system, it is breaks down food and absorbs nutrient through digestion. Endangerment sites of the elbow. Medial elbow. The area between the medial epicondyle of the humerus and the olecranon process of the ulna. This area contains the ulnar nerve. Lateral elbow. The area between the lateral epicondyle of the humerus and the olecranon process of the ulna. This area contains the radial nerve. The differences between the uh, medial elbow and the lateral elbow is ang medial elbow kay makafeel tag pain in the inner part of the elbow, while the uh, lateral elbow is the pain in the outer part of the elbow. So kasagaran maka-experience ani og mga pagpanakit sa elbow is uh, like mga athletes muduwa sila og like mga like golf sports, tennis, and also weightlifting.
Circulatory system responsible for transporting oxygen and nutrients throughout the body. Massage therapy supports circulation, which can enhance recovery and vitality. The circulatory system, also known as the cardiovascular system, is a network of organs and blood vessels responsible for transporting blood, nutrients, gases like oxygen and carbon dioxide, hormones, and waste products throughout the body. It includes heart, blood, and blood vessels, arteries, veins, and capillaries. So those are the included of circulatory system. Musculoskeletal system. This system includes muscles and bones, crucial for movements and posture techniques. at improving flexibility and strength can help clients achieve their wellness goals. So from the word musculoskeletal, it is all about the muscles and bones. So if you aim to be an athlete or professional athlete, so you need to sure that your muscle and bones is in the kanang bitawng kanang is not kanang kuan siya kanang wala siya injury kanang i-sure nimo nga ang imong muscles kay kanang kuan siya kanang na siya kanang strong enough para mo kanang like moapil ka og volleyball player, you want to be a volleyball player, then your muscle is not kanang dili siya ano bitaw murag dili siya kanagi siya mga injured. So i-make sure gid nimo nga usa ka mo apil mag-aim ka nga to be an athlete, make sure that your bones or muscles is kuan jud siya kanang okay siya. So next is nervous system. Nervous system controls bodily functions and responses. Understanding its role allows therapists to utilize relaxation techniques that promote the parasympathetic responses and reduce stress. So, kaning nervous system kay mo ni siya ang naka-function og nag-response sa like magpa-massage ka. O mo ni siya murag makakuha ni siya kanang murag mo ni siya mag-function nga magpa-massage, magkuha ka og massage therapist. Kanang murag mo gini siya murag makadetect ni siya nga kanang kuha na siya kanang mag-massage. Makawala masag gina sa stress ang massage no. O mo ni siya murag mo ni siya ang makapa kanang detect ni siya sa ato ang kanang kalawasan. Add pa sa DI. So og magpa-massage sad ka dili kanang every massage kay namasad gina siya kanang step no. Dili man ka kanang pwede nga magpataka-taka ka og kanang massage kanang taka-taka kag hilot kay pwede masad na siya nga imbes nga makawala sa stress makasamot hinuon kay nasamutan man ang imuhang kakapoy kay wala naman siya nisakto pagka-massage kay dili naman siya in line sa kanang sa imong gibati. Next is endocrine system. Endocrine system regulates hormones and metabolism. Wellness practices can promote balance with the system through stress management and nutrients counseling. So, the endocrine system is a network of glands and organs that produce and release hormones into the bloodstream. So, the endocrine system works alongside the nervous system to maintain the body's homeostasis, coordinating various processes that are essential for overall health and functioning.